Hello, I am Greg Bernica, the Executive Vice President, CEO of the Harris County Medical Society. I'll provide a short orientation on HCMS activities. HCMS is the professional organization of physicians in the greater Houston area. We are the largest county society with over 12,000 members. HCMS is affiliated with the Texas Medical Association and represents about 25% of the TMA membership. We are a member-driven organization. Our all-physician board, which represents the various subsets of our membership, establishes all of our policies. Our key to success is that we receive thousands of hours of volunteer physician support each year. The HCMS vision is to empower physician leaders to the benefit of our community. Our mission is to be the leading advocate for physicians and patients at all aspects of medicine. With our broad mission and large diverse membership, our board has created a structured strategic planning process to focus our efforts. We've had several planning retreats over the years for our physician leaders to broadly craft the plan. Each year, our committee members provide input on their section of the plan. Our officers compile the information that they provide and then vote on these priorities for the upcoming year. All tactics are assigned back to our physician committees to oversee the implementation of the plan. These are our 5 goals in priority order as voted on by our membership and by our leadership. Our first and highest rated goal is advocacy. HCMS and TMA advocate for physicians in all practice settings. Many of our activities benefit all physicians. Others are focused on certain settings. We advocate on socioeconomic and legislative issues and prevention of physician burnout. I'll go into more detail on each of those areas. Our socioeconomic efforts help physicians implement system changes in an efficient manner and identify administrative burdens that need to be addressed in future laws. We help practices get paid for their services and address prior authorization and other payer hassles. We have assisted in collecting over $28 million since 2000, more than we have collected in dues for that period. In 2019 alone, we addressed over 550 individual complaints. We work with our local, national, and state elected officials to improve the health system for physicians and their patients. The legislative process begins with the development of TMA policy. With 25% of TMA membership, our delegation to TMA has a lot of clout in the changing of these policies and getting HCMS physicians elected into the TMA leadership to carry out the policies. A comprehensive communication plan assists with all these efforts and all of our other efforts. Addressing physician burnout has been a priority since our 2016 retreat. In addition to our focus on changing the system, we have identified items that help physicians thrive and cope with the current system. We are also meeting with hospital systems to identify and develop collaborative efforts. We have a network of psychiatrists and psychologists to assist our members in needs. Specialty societies assist physicians with the clinical side of the practice. As a geographic society representing all physicians, our focus is on the business side of the practice. By providing tools, services, and CME programming, we accomplish that. We also provide networking opportunities for physicians in all specialties to develop referral relationships. Because of our size, we break our membership into subsets to focus our communications to and from physicians. We have 7 geographic branches throughout our large county. Our membership meetings are conducted in each of these branch areas. We also have councils and sections for local specialty, international, and minority society leaders, hospital chiefs of staff, women physicians, young physicians, and retired physicians. We have a physician directory that can be searched by numerous criteria and is updated daily. We have various forms of communications vehicles because of our wide range of member preferences. The HCMS physician president is our principal spokesperson. The president has a rapid response team of leaders that can respond quickly to media stories and proactively advocate for our issues. Physician autonomy and improving quality of medical care are the focus of our third goal. We work closely with our state licensing board. Our board of ethics addresses complaints against physicians. We have a counseling program to assist physicians who have had substance abuse issues. In March, we will be launching our 4th survey on physicians' opinion about quality care at their hospitals. This slide highlights stats from the last survey. Many hospitals are working closer with their medical staff as a result of the survey. For the last 3 years, we have presented the results to the College of Healthcare Executives, the Hospital Administrators Association. Our 4th goal is to improve the health of our community. We have prepared physicians for disasters and coordinated physician assistance to our citizens after the disaster. We work closely with our EMS system, our public health organizations, and many community groups. HCMS has an affiliated entity, the Houston Academy of Medicine. The Academy is an educational community service tax-exempt organization that can accept charitable contributions. It oversees all of our community activities. The Academy formed a medical library in 1915 that evolved into the Texas Medical Center Library, which today serves a majority of the TMC institutions. We formed the Gulf Coast Regional Blood Center in 1975 to address chronic blood shortages. We formed the Health Museum as a hall within the Museum of Natural Science. In the 1990s, we raised money to build the freestanding McGovern Health Museum. Our physician leaders still play active roles with all these organizations. Our last goal is to make sure we have the infrastructure and resources to accomplish our plan. We also have extensive policies to ensure that all physician subsets are represented throughout our leadership. We accomplish all of this while maintaining the lowest dues among the 5 largest county medical societies. Please go to hcms.org for more information on any of our services, or call us at 713-524-4267. Thank you for your time.